This is a mini tutorial on how to use the rubber tip stimulator in your everyday dental use. The purpose of the rubber tip stimulator is primarily used for gingival massage and recontouring of the gingival papilla after periodontal therapy. It can also remove plaque along the gingival margin. Other possible roles of the rubber tip stimulator is to increase gingival circulation, keratinization, and epithelial thickening, although there is not much evidence or research to support these. The rubber tip stimulator looks like a rubber tip, and it's attached to a metal handle, and you can buy it at most stores like Walmart, Shoppers Drug Mart, all those types of stores, or online. How to use the rubber tip stimulator is that you place the side of the rubber tip interdentally and slightly pointing coronally, as the image shows. And so it's kind of like a 45-degree angle. You move it in and out with a slow stroke, and as the video shows, you just kind of rub the tip along the gum line and in between the teeth. This is also really good if you have big gaps in between the teeth. Here we go. And once all the appropriate areas are completed, you can rinse the stimulator with soap and water, or just water, and then store in a clean, dry place. And replace the rubber tip as it becomes worn, cracked, or splayed. Here's an image of the rubber tip being used, and another image. And this is a common product found. This is from the brand Sunstar. I'm pretty sure it costs about $3.50. It is under $5, so it's very affordable. And you can get a refill pack of the rubber tips for when you have to change the tip. So the indications of use, it can be for anyone for the daily use. Clients with inflamed gums, gingivitis or periodontitis, this would be good to stimulate blood flow in the gums. Use after periodontal therapy. Clients with implants, this would be good to use around the abutment surface to remove plaque around that area. It's a rubber tip too, so it wouldn't disrupt any of the fibers, periodontal fibers around the screw of the implant. And clients with wider spaces between your teeth, this would be good to get in between to remove the plaque. And there are no contraindications. Barriers to implementation could include dexterity limitations. So clients may require a thicker handle if this is a barrier. A tennis ball or a bike handle or a cloth wrapped around the cleaning aid could assist with this barrier. And it's a very affordable product, so cost should not be a barrier for this product. Expected benefits for this that the clients should expect is that plaque will be removed around the gingival margins and interdental papilla. Stimulation of the surrounding gingiva around each tooth will occur, and recontouring of the gingival papilla will happen. Increased circulating, dilation, keratinization, and epithelial thickening will also occur, although this has not been studied in depth, but studies have shown that plaque biofilm removal has resulted in gingival health from oral hygiene practices, and plaque is removed around the teeth that are being used with this rubber tip stimulator, so that is probably why there is some healing that will occur when it is used. So that is how you can use the rubber tip stimulator and why it would be beneficial for your overall periodontal health. Thanks for watching.